Hi, I'm Dr. Ghislaine Lewis from the University of Lynchburg, and I'm part of the Centra Community Health Needs Assessment Team for 2024. Today, I'm going to be working on getting you up to speed on how to conduct our focus groups and some strategies and tips and tricks to get you through these 90 minutes of focus groups. So for the tutorial, we will go over objectives, recruiting and planning strategies, the questions that will be asked of your target populations, how to facilitate your focus group, data collection, reporting those findings to Centra, how to wrap up your focus groups, and some of the ethical considerations I want you to think about as you go through the focus group process. So, community health assessment focus groups are really important for several reasons. They really play an integral role in public health planning and intervention. The focus groups provide a platform for participants to discuss their views, experiences, and needs in depth. So, the qualitative data that we get from the focus groups is going to offer insights that the surveys and the quantitative data might miss. And it allows health professionals to understand some of the complex issues happening around healthcare from the community's perspective. These focus groups are really instrumental to helping to identify specific health needs in a community, including highlighting unrecognized or emerging health issues. And this information really is vital for developing targeted health programs and policies that are actually going to address those needs. So, when we do our focus groups, they're going to engage community members in the health assessment process. They're going to give them a voice in helping to identify health priorities and designing interventions. And it really does demonstrate Centra's commitment to listening and involving the community in health decisions. And these focus groups really do help to build trust between health professionals and the community members that they serve, which is really integral for the success of public health initiatives. So, what we're hoping is that these focus groups are going to bring together diverse stakeholders, including community members, health professionals, and policymakers. And by collaborating, this can lead to a more comprehensive and integrated approach to addressing these health issues. So, Centra really is committed to hearing from the communities that it serves. We want to learn more about the health needs and the factors that impact the health of residents in our area. And so, we're going to be conducting our focus groups across sectors. We're going to talk to stakeholders, we're going to talk to service providers, we're going to talk to community members and community leaders, all as part of the 2024 Community Health Needs Assessment. So, as you plan your focus groups, I want you to ensure that you are recruiting or at least thinking about diversity as you're recruiting your participants. I want us to aim for a mix of races, ages, genders, backgrounds as we think about who we're trying to recruit to participate in our focus groups. Consider hosting focus groups at times that are convenient for participants. Sometimes even evening and weekend sessions might increase accessibility for our community members. Choose a neutral location that's accessible, ensure that it's comfortable and free from distractions. And then I want us to think about some of the places to recruit participants, not just through our health districts, but maybe using some social media, some online channels, community bulletin boards, and then relying on our patients and our community members to really spread the news about the focus groups through word and mouth. Being able to clearly communicate the purpose of the focus group and talking to people about any incentives being offered. In this case, I think it's lunch or a snack. So, any incentives being offered really helps to gather an audience for our focus groups. So as we go ahead with working out how to facilitate our focus groups, each focus group will have a facilitator and a scribe. The facilitator and the scribe will introduce themselves, they will explain why they're meeting with participants, and they will let participants know that all of the conversations that are happening will be kept confidential. They'll tell participants that the scribe is going to be capturing notes from the meeting and will be audio taping the meeting. It's really important that you tell participants that the information from the meeting will be included in writing in the 2024 Community Health Needs Assessment. However, everybody is going to be de identified, so all identities are going to be kept confidential. It's really important that you review the consent or the confidentiality form with participants, have them sign it, and have either the facilitator or the scribe serve as a witness on each of those statements, those confidentiality statements that are being signed. And then before you begin, you want to ask participants if they have any questions around the purpose of the meeting, that they understand what they signed, and then you lead them to the table where they're going to be conducting the focus group. You want to make sure that at the beginning of the focus group, each participant introduces themselves, and then you will begin your questioning. And the questions for these focus groups are expected to last about 35 to 40 minutes. So, the questions that are going to be asked of our target population, which are going to be our community members, are: what are the top five greatest needs in your community around health and wellness? What do you see as the cause of these needs? What resources are available in the community to help meet these needs? What are the barriers to accessing these resources? What is the one issue or need we can work on together to create a healthier community, and how? And then finally, I think it's really important that you wrap up by asking if there's anything else they want to share. Now, this question is completely optional depending on how much time you have left at the end of your focus group. So, one thing I want us to think about is how do we work on audio recording our focus groups? So, before the focus group begins, I want you to let the participants know that the session is going to be audio recorded. You want to make sure that you have their consent. Explain that the recording is going to be used to help support the data collected from the surveys, and everything again is going to be confidential. You want to make sure that you're using a reliable digital recorder with good sound quality. If you have an iPhone or you're using an iPhone to record, I would suggest using the Voice Memos app to record your focus groups. And if you have an Android, then I would suggest the Smart Voice Recorder app to record your interviews, your focus groups. So before you begin, I want you to test your recording equipment. First of all, charge your recording equipment. You want to make sure that your phones are completely charged. Then you want to test your recording apps to ensure that they are working correctly and that they are capturing sound from all vantage points of the room that you're in. So you want to place that recorder in the center of the table so that it can capture the voices of all of the participants. You want to really be aware of your surroundings. So if there are places where air conditioners are blowing or windows are flapping, you want to make sure that you move your participants and your focus group members away from those distractions, because the recorder will pick up a lot of that background noise. As you go through the focus group, I want you to periodically check to make sure that it's still recording. And if possible, I always tell my students, if possible, have two phones recording during the session. Having a backup device really does give you some amount of confidence as you go through the focus group process. Now, the next thing I want us to think about is how do we take notes during or focus group. So our scribe is going to be taking the notes during the focus group, and you want to make sure that you, as the scribe, are capturing the participant responses as well as interactions that can be used for later analysis. So we're going to designate a scribe who is not the facilitator to allow for full concentration on facilitating the discussion. And the scribe should be familiar with the questions that are going to be asked and the objectives of the focus group. So when Centra sends you your template, you should have a note taking template that's going to align with the questions that are being asked for this focus group. And so the template's going to help you organize your thoughts and the observations really systematically. When you're taking your notes, you want to focus on recording direct quotes, any unique insights, and general sentiment of the group as you go through the focus group process. You want to observe and record body language, expressions, any dynamics between participants that might influence how the focus group discussion is being interpreted, or even the direction of the focus group discussion. You want to quickly jot down any overall or repeated themes that keep coming up as part of the discussion, any significant points. And I think it's really important to know that you don't have to write full sentences, right? Short keywords, short phrases that will work for the data analysis. So, how do you report your findings to Centra? So once you're done, you want to make sure that you label all of your notes and all of the recordings with the date, the focus group, center, and any other relevant details that are going to make it easy to identify that focus group later when it's time for analysis. The focus group After the focus group, the facilitator and the scribe should debrief and think about any discussion points or observations that they noticed during the session, just to make sure that they are both on the same page and no details are being overlooked when you send your notes over to Centra for analysis. So we're going to send our notes and our audio recordings to communityhealth at lynchburg.edu. So COMMUNITYHEALTH at lynchburg.edu. So community health at lynchburg.edu. And I want you to send those over as soon as possible. So as soon as you've labeled and scanned, just send it over to us and we will take it from there. So at the end of your focus group, you want to make sure that you summarize any key points. You want to thank the participants for their contributions. You want to let them know that their input is going to be used to help augment the community needs survey results, and that the community health needs assessment is going to be publicly available in the fall. You also want to briefly talk to them about what went well and what could be improved for future focus groups if you have the time. And then for those of you who are facilitating and acting as scribe, you also want to think about what areas can be improved as you work as a facilitator or a note taker, so that when the next community needs assessment comes around or your next focus group comes around, you're better prepared. So as an academic, I am really big on the ethical side of things. And so some ethical considerations that I want us to reinforce before we wrap up is that you really should think about how much participants know about the purpose of the focus group. Participants really should understand at a high level what their participation is going to involve, how the data is going to be used, and any potential risks around the data. They should also be told that the focus groups are voluntary and should understand that they can withdraw from it at any time. You want to inform participants how confidentiality is going to be maintained by not using their names in any notes, reports, or publications that all of the data, the notes, the recordings are going to be kept in a secure location with only access to by authorized individuals. You want to be prepared to manage emotional responses. Sometimes when we talk about healthcare in our city, people can get really heated. And so we want to make sure that there are support systems in place for if somebody has one of these emotional responses to some of the sensitive topics we're going to be discussing. At the end of the focus group, you always want to give participants a chance to share any concerns that they may have. So, this is the end of this session. If you have any questions about the focus group process, any questions about where to send your focus group results, any questions at all, you can reach out to pat.young@centrahealth.com or Ghislaine Lewis, which is going to be Lewis_G@lynchburg.edu. Thank you so much for your time, and I hope this was enjoyable.